The topic we're going to discuss today is the intestinal diverticula, and particularly if we define diverticulum, so that is, you can say, the outpouching from any wall. So it can be anywhere starting from the esophagus to the rectosigmoid junction, but usually the rectum is spared. So usually it can be in the small intestine, it can be in the jejunum, ileum, duodenum, or it can be in the colon. And the colonic diverticula are more common in the large intestine as compared to the small intestine. And if we talk about the diverticula of the small intestine, we know that they're much more common in the duodenum as compared. If we talk about the acquired diverticula, they're more common in the duodenum as compared to jejunum and ileum. And jejunal ileal diverticula, they're also a part of the intestinal diverticular disease, but they're also most common in the jejunum. Now, if we talk about the intestinal diverticula, there are many hypotheses which are trying to, establish a cause or establish a phenomena behind the development of the intestinal diverticula. So, most commonly, it is hypothesized that there is some kind of abnormality to the smooth muscles of the intestine, or you can say it's basically the motility. Sometimes it's a motility dysfunction, and because of that, there is, you can say, herniation or the outpouching from the wall. Basically, the intestinal diverticula, if we are more precisely talking about the small intestinal diverticula, so they are divided into two groups. One are the congenital diverticula, and other are basically the acquired diverticula. So if you talk about the congenital diverticula, that means it has something related to the genetics, and somehow it's congenital, maybe present by birth. And some are acquired diverticula. There is a clear-cut demarcation between the congenital diverticulum and the acquired diverticulum. So the congenital diverticulum is actually the one which has got all three layers of the wall. We know that actually, if we talk about the wall, so we have the mucosa, the submucosa, and the muscularis mucosa, and then we have the serosa. So a true diverticulum is basically a diverticulum which is constituting the all three layers. Like when you talk about the Meckel's diverticulum, it's a congenital diverticulum. Whereas if we talk about the acquired diverticulum, so acquired diverticula are the ones that are basically, they're not present by birth, and they can be present in any time period of your life. Mostly they are common between 40s and 60s, and more common in men population as compared to women. And these diverticula are actually, they're not the true diverticula, they are false diverticula, and that means that all three layers are not present in such diverticulum. So it can be a mucosal herniation, or you can say the muscularis layer is not a part of that diverticulum. So a true diverticulum is the one which is comprising of all three layers of the wall. As compared to the acquired diverticulum, it's not comprising of all three layers of the intestinal wall. Instead, it is comprising of mucosal pouch only, and there is no muscular layer to be a part of the diverticulum. So the acquired diverticula, the hypothesis I already explained. Like most of the time, they say that there is some kind of motility disorders, or there's some kind of abnormality in the smooth muscle regulation, and because of that dysregulation, there is kind of weakness in the wall. So that weakness of the wall leads to the herniation, or you can say these diverticula are more common when there's a bacterial stasis or bacterial overgrowth, or basically most of the debris pylori is stasis over there. So most of the time these diverticula, they are more common in the duodenum, and most commonly if we talk about the duodenal diverticula, so they are peri and pylori part of the duodenum, and ampulla of the bladder. That's the common site for the duodenal diverticula. As compared to the jejunal islet diverticula, jejunum is proximal jejunum. More specifically, it is the part which is most commonly is a place for the acquired diverticula. So remember this classification: the congenital diverticula and acquired diverticula. So the congenital means that they are present by birth, and acquired, that means they were not present at birth, and it has no relationship with the congenital malformations or mutations, and they are basically formed because of them secondarily processed in the intestine, and most of the time explain the hypothesis that there is a smooth muscle dysregulation and some kind of motility disorders, and because of that the stasis, when the intraluminal pressure rises and there is bacterial overgrowth, these all are the factors which are responsible for the formation of the diverticulum. And remember that the congenital diverticula, they have 3 muscular cords, all 3 layers of the intestinal wall are involved. As compared to the acquired diverticula, they consist of only 1 layer, that's most of the time mucosal herniation. Meckel is an example of the congenital diverticulum, which is present at the antemesenteric border of the ileum, and we will be talking about Meckel's diverticulum in detail in a couple of minutes. While when you talk about the acquired diverticulum, duodenum, jejunum, in ileum, and colon, in case of the large intestine, they're the sites where these diverticulum can be present, and sometimes they are silent and they are incidental findings, but sometimes they present with complications and inflammatory changes, and sometimes bleeding and perforation, and we will be discussing about the clinical manifestations in a while.